Treating a medical emergency at sea can be very different from dealing with the same problem ashore. Ashore, there is nearly always professional medical help nearby. But at sea, help may be days away.
Fishing is dangerous. The question isn't whether an injury will occur on a fishing vessel, it's when. Fishermen have only themselves to depend on in a medical emergency. Learn as much first aid as you can. Be familiar with the medical supplies aboard the boat and know how to use them.
Voyager, this is Comstay Kodiak, Roger.
You aren't entirely alone. You have radios. This videotape is designed to help you learn specific treatment techniques and teach you to become the eyes, ears, and hands of the medical professionals who can guide your treatment efforts by radio.
Johnny, get the first aid kit and a blanket.
First, treat the immediate threats to the patient's survival and stabilize his condition. When he's stable, survey his vital signs and the extent of his injuries. At that point, call for help. If you can provide accurate information to the Coast Guard, they'll relay professional advice on what to do until help arrives. Just remember, their advice will be only as good as the information you provide.
20 feet long. House forward with a white house top. Standing by on 40.
As the first responder, you're the person who is best able to help the patient until someone else more qualified arrives. You'll be scared and you'll feel extremely inadequate, but the problem isn't going to go away. You're the patient's best hope.
Hey, Bill's been hurt!
Jeanette, Bill's been hurt.
What happened?
He got hit by the block.
Randy and Bob, we'll secure the block. Get him down.
Please take to the rail.
Study the scene before you rush to help. If the patient has been struck by a swinging block, secure it before it hurts somebody else. Your first responsibility is to protect yourself. You can't help the patient if you get hurt. Work quickly, not frantically. Carry a good first aid kit aboard, but don't waste time looking for ready-made materials. Do the best you can with whatever is at hand. Keep the patient lying down. Don't try to move him until you're sure that movement won't cause more harm. Keep him quiet. Keep him warm, but not hot. Reassure him as you survey his injuries. The first step is to identify problems that could kill the patient in minutes. This is the primary survey, or the ABCs of first aid. ABC stands for airway, breathing, and circulation. It means checking to see that the patient has an open airway, that he's breathing, and that his heart is beating.
And he's got a pulse. Bill, can you hear me?
When the patient appears unconscious, gently shake him by the shoulders and shout to see if he responds.
So just lie real quiet for a minute.
If he can talk, he can breathe, but you have to keep watching him in case his breathing stops. Remember the ABCs. They always come first.
CPR stands for cardiopulmonary resuscitation. It means providing breath and heartbeat for patients whose own breathing and heartbeat have stopped. Performing CPR can be exhausting, but you need to remember to continue as long as you can. Victims have been revived after periods of 2 hours or more.
Don't quit too soon. If the patient doesn't respond,
Randy,
place
are
him
you
on his
okay?
back on
Are
a
you
hard,
okay?
flat
You need
surface.
some help.
If you suspect back or neck injuries, carefully stabilize his neck as you gently roll him over. Clear the airway by tilting the head back and lifting the chin. Place your face close to his and look to see if his chest is rising and falling. Listen for the sound of breathing. Feel for exhaled air against your cheek. If there are no signs of breath, place your mouth over his and form a seal. Pinch the patient's nostrils and give 2 full breaths. After 2 successful breaths, check the patient's pulse at the neck. If there is no pulse, expose the patient's chest. Feel for the lower end of the breastbone with 2 fingers. Place the heel of one hand just above your fingers so it rests on the lower half of the breastbone. Keep your arms straight. Compress the breastbone straight down from 1.5 to 2 inches for each compression. Continue performing 15 compressions at the rate of 80 to 100 per minute, followed by 2 breaths. Pause briefly after the first minute to check for signs of pulse and breathing. If there is no breath or pulse, continue CPR. Pause every 4 to 5 minutes to recheck for breathing and pulse. Someone else can take over when the first responder is exhausted. Maintain a regular rhythm as you switch. If the patient has a pulse but isn't breathing, open the airway with the head tilt chin lift method. Pinch the patient's nostrils and tightly seal his mouth with yours. Give 2 full breaths. Remove your mouth slightly from the patient's mouth after each breath. Let him exhale by himself. Watch the chest to see if he has started breathing. If he hasn't, continue breathing for him as long as there is hope. If somebody starts to choke and is able to cough and talk, leave him alone. Coughing helps more than you can. If the victim can neither cough nor speak, the problem is serious and you've got to help. He'll probably hold his throat with both hands. He may be embarrassed and try to hide. Ask him if he's choking to see if he can talk. Tell him you know how to help. Make a fist with one hand and put the thumb side against his body, just above his belly button. Place the other hand over your fist and begin thrusting sharply inward and upward. Make the thrusts firm and keep them coming until the victim starts to cough.
Are you okay? Are you okay?
Lay an unconscious victim on his back and thrust with the heels of your hands. Give 6 to 10 thrusts, then sweep out the mouth, open the airway, and attempt to perform rescue breaths. Continue performing thrusts and breaths until his chest begins to rise and fall. Be ready to perform the ABCs. If you start to choke and there's no one to help, perform the same kind of thrusts on yourself using your fist or the back of a chair.
Controlling severe bleeding is an urgent priority, but bleeding may look much worse than it is. Learn to recognize the types of bleeding. Don, what happened?
The anchor went out. I got caught in it.
Okay, look, settle down. We're gonna fix this thing. Randy, we need the first aid kit.
Arterial
Look, we're
bleeding
gonna need to
is
get some
bright
pressure
red
on this,
and gushes out of the
and,
wound in
as soon as we
jets
get
or
the kit out
spurts
here, we
in
can
rhythm
go
with the
with it.
patient's
All right.
heartbeat. It is much redder than the blood you're used to seeing from minor cuts or
Get
scrapes.
some direct pressure right on
Bleeding
that.
from veins is dark red and comes out in a steady flow. If the victim is unconscious and you have help, one person should perform the ABCs while the other controls severe bleeding. Direct pressure and elevation control the bleeding from almost all wounds. Using a thick pad of gauze or cloth as a dressing,
Look, Randy, this
apply
is,
direct
this is
pressure with
bleeding
your
right
palm.
through these. I'm gonna need
The
to
dressing
have a
should
bigger
be
pad.
sterile or as clean as possible.
I'll keep
Use
the
clothing
pressure on while
if
you
nothing
bring
else
this
is
stuff
available.
out for me.
Don't remove the dressing, even if it becomes blood soaked.
Gonna have to
Add
lay
another
him back
dressing on
down
top of the
and
first
elevate
one
his arm.
and continue applying
So if you'll
direct
come
pressure.
around, I'll help him back down
Raise
here.
injured arms or legs to a level higher than the heart unless movement will cause further damage,
Okay.
as in the case
Now,
of a fracture.
Can you get me another 4x4? These
An alert patient may be able to apply pressure to his own wound so you can attend to other injuries or treat other patients.
take it around.
Once the bleeding is under control, a pressure bandage can replace hand pressure on most body parts. Center the bandage over the dressing, wrap the ends in a circle, and tie the knot directly over the wound.
Don, I'd like to check your bandage and dressings here.
In the hours
First of
after
all,
the
does it
injury,
feel too
keep
tight?
the pressure bandage from becoming a tourniquet.
Great.
Look below the
Fingers
bandage
feeling
site for
numb or
swelling,
tingly?
numbness to touch, sensation of pins and needles,
Do you have any
white or
general
purple color,
throbbing in
and
your whole
pain.
hand and finger?
Pressure points help control bleeding until a pressure bandage can be applied. They're located where major arteries pass over bone. Use pressure points in combination with direct pressure and elevation. The easiest pressure points to find are located along the inside of the arm and in the groin. To slow bleeding to the lower arm or hand, place your fingers on the inside of the upper arm and squeeze. To slow bleeding to the lower leg or foot, place the heel of your hand in the groin and press against the thigh. If you have a blood pressure cuff, place it over the pressure bandage and pump it to a maximum reading of 150 on the gauge. Leave it inflated for 15 minutes. Then check to see if the bleeding has stopped.
Tourniquets are used only in extreme cases when nothing else works. A tourniquet can only be used on an arm or leg and probably means losing the limb in exchange for saving the life. If the situation isn't urgent, never use a tourniquet before you have obtained professional advice.
To make a tourniquet, take a wide band of fabric or other material and place it just above the wound on the side nearest the heart. Take 2 light wraps around the limb and tie an overhand knot. Place a short, strong bar on the overhand knot and tie a second knot above it. Twist the bar until the bleeding stops, no tighter. Secure the bar in place. Record the time the tourniquet was applied and attach it securely to the patient where it is highly visible, or write it on his forehead. Don't loosen the tourniquet until a doctor tells you to. Treat the victim for shock. Call the Coast Guard.
We've got a leg injury.
A patient wearing a tourniquet must be evacuated as soon as possible.
The patient may have hidden injuries that are more serious than the obvious ones. Your next job is to conduct a secondary survey to look for hidden problems and measure his vital signs. What'd you do?
I fell on the cleat. I fell on the cleat.
Okay, come on, let me lay you down.
Talk to a conscious patient as you survey. Tell him what you're doing and ask him if it hurts when you touch him. Don't be self-conscious about touching the patient, whether it's a man or a woman.
Hey, Don, bring the first aid kit and bring a pencil and paper, too.
If you have help, have someone write down what you find. Gently feel the neck, head, and face to check for skull or upper spine injuries. Check your fingers frequently for signs of blood or fluid loss. Look for wounds, soft spots, deformities, sites of pain, or anything else that doesn't seem right.
Yeah, I'm going to put a light into your eyes.
If you have a flashlight, check the eyes for pupil reaction. Do they shrink when the light hits them? Does one react differently than the other? Make notes for the Coast Guard. Slide your hands gently beneath his back and shoulders, looking for the same signs. Bring your hands upward along his sides, checking for rib and chest injuries. Press gently on the 4 quarters of the abdomen to check for internal injuries. Even an unconscious patient may react to your touch if it hurts.
Over here, down here. Okay, I'm going to press in on your hips. We're just seeing if anything else is hurt.
Gently press on the pubic bone and over the crests of the pelvis. Then sweep your hands along the groin on either side. Check each hand for blood and look for urine or feces, which indicate loss of bladder or bowel control. Feel each leg from the hips downward. Have the patient press with his feet against your palms to see if he has control of his legs and can apply equal pressure. Feel the patient's arms for signs of injury and have him squeeze your fingers with both hands.
Now, I want you to press on my hands. Just squeeze good and tight. Good.
Look for deformities, sites of pain, and equal strength.
The vital signs are pulse, respirations or breath rate, blood pressure, and temperature. You'll need a watch, a blood pressure cuff, pressure gauge and stethoscope, and a thermometer. They should be part of each vessel's first aid kit.
Pulse is the number of heartbeats per minute. The neck pulse is easy to check. To find it, place your fingers on the patient's Adam's apple, then slide them into the groove on either side. Count the number of beats in 30 seconds and multiply by 2.
Don, his pulse is 40, and that's for 30 seconds, so multiply by 2.
If the pulse is weak or irregular, count the number of beats for a full minute. You can also check pulse at the wrist or elbow. If the patient is unconscious, check his pulse frequently to be sure his heart is beating. If it stops, begin CPR. Respirations measure the number of breaths per minute. Watch the patient's chest rise and fall and count each rise and fall as one breath. If the respirations are hard to detect, feel for the rise and fall or focus on a button. Don't let him know you're counting breaths or he may change his respiration rate and fool you.
Don, you can record his respirations at about 18.
Blood pressure is measured in millimeters of mercury. A common reading is 120 over 80, although there may be variations due to age and health. The first figure represents pressure when the heart is pumping, and the second figure represents pressure when the heart is at rest. Have the patient sit or lie down with one arm supported. Place the cuff around the arm above the elbow. Close the valve on the bulb by turning it clockwise. Find the arterial pulse inside the elbow. Place the disc of the stethoscope over the spot where you felt the pulse and hold it in place. Pump the cuff until the mercury or needle reading is about 200. Loosen the valve slightly to allow the pressure to drop slowly as you listen for a faint heartbeat. If you miss it the first time, reinflate the cuff and try again. The number on the scale where you hear the first beat is the top half of the blood pressure reading. Continue slowly deflating the cuff until the sound disappears. The number on the gauge where the sound disappears is the bottom half of the reading. Record both figures and deflate the cuff. If you can't get a reading in this manner because of noise or poor technique, find the radial pulse at the wrist. Pump the cuff until the pulse disappears. Now deflate the cuff slowly until you feel the pulse again. The gauge reading where the pulse reappears is the top half of the blood pressure. It's the only figure you get with this method, but it's still meaningful to the professionals.
Okay, how do you feel now?
I feel better.
Okay, are you dizzy at all? Okay, any pain anywhere else?
Just my arm.
Just your arm.
The
Okay,
final
so
vital
you
sign
get to
is a
work on
description
that.
of the patient.
Too bad.
Is he pale
John,
or
I'm gonna
flushed?
take your
Is his pulse
blood
pounding
pressure
or
from your
irregular?
wrist.
Is his breathing shallow or deep? And is just one side of his chest rising? Can he follow instructions and speak sensibly?
Okay, John, how do you
Descriptive
feel
information
now?
helps the professionals form a picture of the problem.
Okay, are you dizzy at all?
Remember, the advice you get over the
Okay, you
radio
don't have
will
any
be
other
only
pain
as
in
good
any
as the
other
information
places?
you provide.
Okay. This videotape is only an introduction to medical emergencies. Your medical kit should include an in-depth first aid manual, and you and your crew should attend hands-on first aid classes. What follows are a few tips for providing onboard treatment.
Fishing vessels need well-organized first aid kits like this one. All supplies in this kit are numbered, and there's an index to help you find them quickly. There's also a quick reference first aid manual that describes medical problems in plain language. With this manual inside the kit, it's right where you need it when you have to treat an injury. A first aid kit like this one combines materials that help you treat external wounds, like gel foam, a suture kit, and Steri-Strips. The kit includes Silvadene, an excellent medication for severe second and third degree burns. Epinephrine is used as a last resort for severe allergic reactions. You would only use this under the advice of the doctor. To treat pain, start with aspirin. If that doesn't work, try aspirin with codeine. Only after consulting a doctor, use morphine. If you don't have radio contact and you can't get medical advice, morphine should be used only in extreme cases. Whenever you use medication, carefully note the dosage and the circumstances in the medical log. This kind of record keeping can be a vital form of protection later.
Soren, the Coast Guard says we can give you some oxygen because we think you got carbon monoxide down in the engine room. I'm going to hook up a mask for you.
Breathing pure oxygen can be extremely beneficial for injury victims, especially those suffering from shock, bleeding, heart attack, or other injuries to the circulatory or respiratory systems. Few fishing vessels have professional oxygen delivery systems, but most carry oxygen cylinders for welding and cutting. While the contents of these cylinders aren't medical grade, they could mean the difference between life and death in cases of severe oxygen deficiency. To use oxygen, mount the cylinder securely. Attach the mask delivery tubing directly to the cylinder valve or to the output side of a reduction regulator. Be sure that the mask doesn't lift off the patient's face. A slight hissing sound should indicate a beneficial flow.
Okay, I'm going to put it on you now.
Using industrial oxygen should only be considered after consulting with a medical professional. Beware that careless use of oxygen can be extremely dangerous. Be sure that the cylinder contents are verified by a valid label. Use oxygen only in well-ventilated spaces, and be extremely careful not to introduce sources of spark or flame that would pose explosive hazards.
Just take it easy now. Am I going to lose it?
Shock is a serious condition caused by reduced blood supply to vital body parts. Suspect it whenever there's been a serious injury or illness. Treat for shock even if you're not sure of the symptoms. First, check the ABCs and control bleeding. Make the patient as comfortable as possible. Here are some of the symptoms: rapid, weak pulse, low blood pressure, rapid, shallow breathing, glassy eyes and dilated pupils, pale, clammy skin and bluish-gray lips, nausea or vomiting, thirst, confusion or anxiousness, unconsciousness.
You just relax. We're going to get
Put
you
your
all
head down
warmed up.
easy now. Let's put the bucket.
Keep him lying down.
Oh, okay.
In most cases, raise the feet to maximize blood flow to the heart and brain.
You all right?
If he's unconscious and in danger of vomiting, place him on his side. If you suspect spine injuries, keep him flat. Keep him warm, but not hot. Use blankets over and under to maintain normal body temperature.
Get you fixed up. Okay, Bob, I'm going to get another blanket on here to get you warmed up. How are you feeling?
Reassure him as you continue to observe the ABCs and vital signs. Don't give him anything to eat or drink until you get a doctor's okay.
Working out all right.
Call for medical advice. If the patient is obviously in shock, he should be evacuated.
All right.
Internal bleeding is not always obvious, and there's little that you can do to treat it. What you can do is recognize it. Suspect internal bleeding if the patient has suffered a hard fall or a heavy blow to the hips, pelvis, abdomen, or rib cage.
John, I've got to move your hands out of the way and let me check your abdomen and get you straightened down a little bit.
Look for an unusually large area of swelling at the injury site, tenderness to touch throughout the abdomen, or shortness of breath after a chest injury. Internal bleeding may also be caused by ulcers or by repeated retching, as in seasickness. These victims may exhibit bloody coffee ground vomit or black tarry stools. Internal bleeding may progress to shock. Remember, shock victims are weak, confused, lightheaded, and thirsty. If you suspect internal bleeding, check the ABCs, treat for shock, and call for professional advice immediately. Don't let the patient have anything to eat or drink. Stay calm and try to reassure him. Don't move the victim unless it's absolutely necessary. Keep him quiet to assist blood clotting.
Head, neck, or spine injuries are serious. The patient could be permanently disabled by improper treatment. Head injuries may cause immediate loss of consciousness, and the airway may become blocked by the tongue or by blood. If the patient stops breathing, perform rescue breaths, using a jaw thrust to clear the airway. Don't use the chin lift head tilt method. This may aggravate a cervical spine injury.
Somebody get a backboard. Don't move.
Take care in moving any injury victim, especially if he has suffered a hard fall or a heavy blow. First, immobilize the injured parts using a backboard. You can make a backboard out of plywood, a door, or anything that provides firm support and fits through openings. Before you move the patient, ready the backboard, together with straps, belts, or duct tape. Designate a leader who takes a position at the patient's head. The second person should take a position at his feet. Others position themselves along one side. All moves must be done on the leader's command.
Okay, Bob, on my count of 3, we're going to take counter traction to my traction. Mike, don't move. 1, 2, 3.
Take tension on the head and feet. The leader and the person at the feet should maintain hand tension until the patient is strapped firmly to the board and the straps provide the tension. Roll the patient 90 degrees without lifting his head or feet.
On my count of 3, let's roll him back.
Slide the board under him. Be sure his head is held firmly and moves as a unit with his body. If the board is too short, let his feet dangle, not his head. Center him on the board and lay him flat.
Okay, easy. All right.
Place the first strap firmly over his hips. Now, the person at the feet can let go, but the leader should maintain tension. If there is a neck injury, roll a blanket lengthwise and use it as a collar. Slide it carefully under his neck with as little movement as possible. Cross the ends over his chest and secure them under his arms.
Good. All right, now we can get the tape.
Next, secure the head so the leader can let go.
Wounded also, right down and right straight to the edge of the road.
Then place enough additional straps and padding around him so he's firmly secured to the board.
And we'll put the straps in place.
If you have to lift him vertically, place straps under his feet. Try not to jostle the patient. If you've strapped him down properly, you can lift him up a ladder out of the engine room or turn him away from danger like a fire or falling debris. Carry him feet first with the leader at the head. That way, the leader can continue observing the ABCs and the patient's condition.
Jonas, what's wrong?
Pain in my chest.
Have you ever had that before?
No.
A heart attack victim may feel a crushing pain or what he thinks is indigestion.
No.
The pain may extend to his neck, shoulders, and arms, and he may become nauseous or weak.
Like a heartburn.
A first-time victim may deny that he's having a heart attack, but make sure you get professional advice if you have any doubts.
My left arm a little bit.
A little dizzy, maybe? Okay. Let's go in and sit down and see if you're going to feel better just by sitting. Just move
Make
your
him stop
head out.
working and sit or lie flat. You want him to relax and want his heart rate to slow down. If he's had heart problems before, he may have nitroglycerin tablets that increase blood flow. He can take up to 3 in a 10-minute period.
No. I want you to
Call
sit
for
there
medical
and just
advice.
See if it's going to go away.
What's wrong with Jonas?
Randy, Jonas isn't feeling good. I think we better get hold of the Coast Guard on the radio and get some medical advice.
I'll go call.
Burns are common at sea. The best treatment is to stop the heat with fresh water, and fractions of seconds count. Use cool water, not ice. If the burn can't be immersed, apply a cold compress. Continue the cooling for 30 minutes.
Hey, you guys, what's up, man?
If a hot liquid has saturated his clothes, immediately flood the area with cold water. If the burn is on the hands or arms, remove rings, watches, or bracelets before swelling turns them into tourniquets. Never break the blisters. Never use grease, butter, or oil on a burn. there is one prescription medicine called Silvadene ointment that you should add to your first aid kit. Only use it after you've called for help and obtained professional advice. After cooling the burn in water for 30 minutes, cover it with sterile gauze.
Oh man, I got some of that stuff on my arm. Hey, give me some water, bub.
If liquid chemical burns occur, strip away the clothing as fast as you can and flush the area with fresh water for 30 minutes. Brush off chemical powders before flushing with water.
Come quick!
If the chemical has entered the victim's eye, begin flushing with water immediately and continue for at least 15 minutes. First-degree burns are just reddened skin, like sunburn. They may be painful, but aren't serious unless they're extremely large. Second-degree burns include blisters and swelling. If more than 15% of the body surface is covered with second-degree burns, hospitalization is usually required. Your palm is 1% of your body surface. In third-degree burns, the skin is gray-white or charred. The nerves are destroyed, and the touch of a pin cannot be felt over the burn.
Immediate control of severe bleeding is the first priority in treating wounds. Loss of a pint of blood probably isn't serious, but rapid loss of 3 pints will lead to shock in most adults. It may sting a little bit, but I need to see how deep the wound is and what might be involved here.
If the bleeding isn't severe, take a moment to determine the depth of the wound. See if it extends beneath the skin and fat layer into muscle or bone. Inability to straighten or bend a finger or toe may mean a tendon has been cut. If the patient has lost feeling beyond the wound, a nerve may have been severed.
Just the leg hurts. Okay.
In this kind of wound, try to clean the area with soap and water or an antiseptic solution before you apply a dressing. Remove splinters, pieces of glass, or other bits of debris. Flush the wound with sterile solution if you have it, or tap water.
I may have missed. Fine, good. It's just a hard jet and it's done.
Oh, God.
John, we're just about there. The next step is to get the bleeding stopped.
Now use pressure techniques to stop the bleeding and secure the dressings with a bandage.
I'm going to put a lot of pressure on this, John, and I'm going to hold it here for several minutes.
Continue to observe the wound. Watch for rebleeding or excessive tightness of the bandage as the wound swells. Keep the patient quiet, and elevating the injured part should help.
To tell you that it has to be snug, but if it's too
Infection develops after a day or so in contaminated wounds. It hurts and will be accompanied by redness and swelling around the edges of the wound.
feels pretty normal.
Pus may come through the bandage, and the patient may become feverish. Call the Coast Guard for help if you have any doubts about the seriousness of the patient's condition.
Fractures must be immobilized before the patient is moved, especially if the bones penetrate the skin. If there's bleeding, control it first using a dressing and pressure bandage. Then, use any rigid objects to splint and immobilize the fracture site.
Splints should extend past the joints and prevent movement on either side of the fracture. Pad them next to the skin and use extra padding over joints. Secure them in place with cloth ties or tape. Quick emergency splints can be achieved by tying one leg to another or strapping the arm to the body. An air splint can be applied quickly and is usually more comfortable than the rigid type. It can also help control bleeding, but take care that it doesn't become a tourniquet as the fracture site swells. Don't move the patient before you splint him unless there is continuing danger, like a fire.
Hypothermia is the lowering of body core temperature because of exposure to a cold environment. If the exposure is prolonged, the core temperature reaches a level from which the body can no longer rewarm itself. It's a special danger to fishermen because cold water robs body heat much faster than cold air.
Even a few minutes of exposure to the northern oceans can produce hypothermia, and you should suspect it even if the patient says he feels fine. As it cools, the body core seeks to protect itself by cutting off circulation to the arms and legs, where the cooling rate is fastest, and by shivering to generate heat. This way, warmth can be preserved longer around the vital organs that sustain life. In cold water, the process happens fast. The victim soon stops shivering, grows helpless, and loses consciousness. If help arrives in time, the process can be reversed. Otherwise, he will die.
Looks like he's unconscious, baby.
Cold water shock can cause circulatory problems that don't appear immediately, and a hypothermia patient isn't out of danger until his core temperature has returned to near normal. If it's less than 95 degrees Fahrenheit, he needs treatment, and if it's less than 90 degrees, he's in serious trouble. Handle the patient as gently as you can. Rough handling could cause a heart attack. If you have enough help, carry him in a horizontal position. Get him someplace warm and lay him on his back. On most fishing vessels, this probably means the galley floor. You have access to supplies in the galley, and the environment should be room temperature, no hotter. Insulate him underneath as well as on top.
Lay right in the middle of the floor here.
In treating hypothermia, keep in mind that the patient must be rewarmed slowly. Rewarming too fast by putting him in a hot shower or bath could kill him. Gently remove his wet clothing and wrap him in something warm and dry. Use blankets, a sleeping bag, dry clothes, or even a garbage bag if that's all you have. You've got to keep him from getting any colder. If he's mildly hypothermic, he'll be cold but conscious and reasonably alert. Don't give him hot drinks or alcohol. Don't rub or manipulate his arms and legs. Never put him in a hot shower or bath. Keep him quiet and lying flat to stabilize his heart rate and minimize circulatory problems.
We'll get you warm in a minute, John.
Put a watch cap on his head. The head is the source of half the body's heat loss. Check the ABCs immediately. Pulse and breathing rates may be very slow in severely hypothermic victims, and you should search for them carefully. As long as there are any signs of life, CPR isn't necessary.
Here's a hot oh, good.
To help his body rewarm itself, use objects that are warm, not hot. Apply them to the head, neck, chest, or groin. Good choices are hot pads or hot water bottles, chemical heat packs, or objects you have warmed in the oven. Never apply warm objects directly to his skin. Wrap them in a towel and touch them to your own skin first to be sure they're not too hot. The patient's cold skin is very sensitive, and he won't be able to tell if you're burning him.
We might have to climb in there, you know? Yeah.
Another technique for gentle rewarming is body-to-body contact. Take off your shirt, get under the coverings, and press your torso next to his. Stay there until you're sure he's getting warmer.
I'll just cover you guys all up. Sounds good. It's going to be worthwhile. Get right in there and cuddle up. Yeah, you're okay, John. You'll be okay. So how's that temperature look? Yeah, it's just about done now.
You need a rectal hypothermic thermometer that reads down into the 80s to do a good job of diagnosing and treating cold-related injuries. Take the patient's temperature frequently and record the figures. Don't apply heat to his arms and legs. His arms and legs are full of cold blood. If they are rewarmed before the core is warm, cold blood returning to the heart could cause a sudden temperature drop and kill him. As the core rewarms, it will slowly reopen circulation to the arms and legs and warm them at a safe speed.
Hey, Charlie, how's John doing now? He's doing a lot better.
When he stops shivering, is fully conscious and clearly able to swallow, and is obviously nearly warm again, give him warm fluids, but keep him quiet and continue to watch him. Never give him alcohol.
It's hot. Can you hold it? Yeah, it's okay. It's okay. Is that better?
In a medical emergency at sea, you're the patient's best hope. You have to act to the best of your ability. Don't do anything that makes the patient worse. Do whatever you can to make him better. Study the scene and protect yourself. You can't help the patient if you become a second victim of the accident. Conduct the primary survey, or the ABCs of first aid. Make sure his airway is open, that he is breathing, and that his heart is beating. Treat severe bleeding. Make the patient as comfortable as possible, but take care in moving any injury victim. When the patient is out of immediate danger, conduct a secondary survey to look for hidden injuries and measure his vital signs. At that point, call for help. Get the opinion of a medical professional about whether you can continue to treat the problem on board or whether the patient should be evacuated. Even if you don't have lots of training, you can do a good job if you keep cool and use your head.